Good afternoon. This is Sandeep Banga. I'm a cardiology fellow at Michigan State University at Lansing. I'm actually here to introduce Dr. Enoch Akowuah. He's a cardiovascular surgeon at Newcastle University, United Kingdom, and he was here to present his late-breaking trial today on UK Mini Mitral. I will ask him a few questions regarding that today. So, welcome, Dr. Akowuah. How are you doing today?
I'm very well, thank you.
Welcome to New Orleans.
Yes, it's great to be here, and thank you for taking the time to interview me too. That's great.
So, tell me about your study. What you presented today?
Okay, so the study is called the UK Mini Mitral trial, and the study really is to answer a question about the safety and the clinical efficacy of minimally invasive mitral valve surgery. This is an issue that we've debated at length in the surgical community. And this is an issue that patients want some certainty about as they have conversations with their cardiologists and their surgeons about what approach they should have for their mitral valve operation. So this trial hopefully adds to that field of knowledge and helps patients and clinicians make decisions about the care of their patients.
Can you tell me the conclusions of the study? Thank you.
Okay, so UK Mini was an expertise-based superiority randomized control trial in which we randomized patients who were having mitral valve repair to conventional stenotomy or a minimally invasive approach. And the primary question the trial sought to answer was whether your return to physical function and usual activities was greater with mini than conventional surgery. So in answer to your question about what we found was that for patients having conventional surgery, at 6 weeks after surgery, their physical function is not improved relative to baseline, and it takes 12 weeks for that significant improvement from baseline to be observed. But for patients having minimally invasive surgery, at 6 weeks, they've already recovered from their operation, so their physical function scores are significantly higher than at baseline. At 12 weeks, though, the two groups catch up, and so the primary outcome, which was the difference in the mean change in the physical function from baseline to 12 weeks, was similar. So those were the main findings of the trial.
Great. That's a great study. Looks like that to me. What do you think? Will that affect the standard of care or guidelines in future in the UK or in the US?
Yeah, no, I really think this trial will make an important difference because I think one of the things that have been limiting the uptake of minimally invasive surgery has been the uncertainty about the safety and the efficacy of the technique. And what this trial shows for the first time in a randomized controlled trial is that mini is as safe and as effective as conventional surgery. The valve repair rates were the same, and the quality of the valve repair as well as the durability were the same. So I guess the question, if you're a patient, is why would you have a stenotomy? If you can have exactly the same outcomes with exactly the same safety profile and avoid a stenotomy. So I think with that certainty, adoption of the technique will increase internationally.
Oh, that's pretty good about your study. Tell me, what's a learning curve for the new surgeon, because I think more people are not accustomed to this type of surgery. They do stenotomy for this valve repair. What's your experience? What's your thoughts about it?
Okay, I think that's a great question, a very important one, because one of the things about this trial is we're essentially comparing experts. So you have to have navigated your learning curve. So the findings of these trials can't be applied to surgeons who are not experts. So then the question you're asking is, how do I become an expert? Well, in the trial, we set an expertise criteria of 50 cases. So you have to have done 50 cases. And I think that's a reasonable learning curve for this operation. I think with most surgeons after 50 cases will have navigated that learning curve and will start to have the quality of outcomes that we've seen in this trial.
Very good. That's a very nice study, actually. I think this will affect the care of the patient, the US also. Thank you so much. Thank you, Dr.
You're welcome.